So much is about what is the cleaning and how we handle the area as well as the equipments. Now, what are the different other kind of equipments that are being used in the theaters? This is all familiar to each and every one of you. You have seen them during surgeries. What is used, and what is that, the needles or the different sizes. This is what you see, and the shapes. So okay, depending upon where the doctor is going to be using it, this kind of needles are usually used for the over this, just for the skin, the top layer, and as you go deeper, the curve actually increases. So that is what you call all these different sizes. And you have all the eye, the needle with the eye, and you also have the eye, different types of needles again, and the patterns of the suture needle according to the accessibility. So this is exactly what I mentioned. The straight needles, you use it for the skin closure. The curved needles, you use it for deeper suturing, and the half circle needles you use again for much more deeper, and also depends upon how big the patient is, whether he's got a lot of subcutaneous fat, and depending on all that, you use the different sizes and depending upon the surgeon's preferences. This is how you would hold the needle with the needle holder. This is called as the needle holder, and gripping a suture needle with the needle holder. So this is what it is, and this is a kind of needle which is called as the what is that? The swaging needle, or nothing but the atraumatic needle. So you have the entire needle followed by the, what is that? This is a suture. So this comes as a ready pack, and again, all this is depending upon the doctor. Now, how you choose the needle? Okay, so depending, we have different varieties of needle here. They are classified as taper point, cutting or taper cut needles, and conventional cutting or taper cutting needles. Again, why it is? The taper cut is for soft tissues. Reverse cutting, again, what happens is they're very sharp. They are ideal for the skin closure. The conventional cutting, again, are very sharp, and they, what is that, they rather they cut rather than dilate. So it can also be how you go deeper into, so it also helps in the cutting and going deeper into the tissues and kind of suturing the area. Taper cutting ideal for tough and calcified tissues. Okay, when the tissues are very, very tough, again you use the taper cutting, and you can see the shape of it, how it is different from this. So that is how you, it also, it helps, and mainly used in any kind of cardiac and vascular procedures. Okay, this is how we classify needles. Again, we as nurses do not have to worry too much about it, but again, when you are an operating theater nurse, you need to have the knowledge about all this, because you need to know what your surgeon is asking, because you are going to be the scrub nurse assisting the surgeon. So you need to be thorough with the different types of sutures, and eventually, as you gain experience, this will be just a piece of cake for you. Now, there are different types of sutures. They're classified as absorbable sutures and non-absorbable sutures. Absorbable suture is composed of a material that is being digestible by the tissues of the body. So what happens, for example, the common one that we see is called as the Catgut. Okay? So what happens here is, once the suture is being performed, our body eventually just digests it. Okay, it just disappears after a few days. But whereas in the non-absorbable, what happens? It is not affected by our tissues. So what happens is, for example, the different types are here. You have the silk, the stainless steel sutures, again the nylon, or nothing but the what is that, the polyester or the polypropylene sutures. So these are all the various names and the various types. Again, what happens here is the sutures are not being hindered by our body biological activities of the body tissues. So what happens is, it's not being absorbed. So once the surgery is performed and the sutures being done, once you go back or get discharged from hospital, after a few, maybe a week or 10 days, what happens? You see that your wound is getting healed, but the sutures remain. So what happens? Such sutures are called as the non-absorbable sutures, and for this you have to come back to the hospital in order to get it removed. So that is these sutures. Now, how do we classify sutures? And nothing but, now as I showed you the picture there, you have the different types: taper end, blunt point, conventional, reverse cutting. Again, you have seen this, and for what are the different uses. Okay, the straight and the conventional cutting are you mainly used for the skin, and how you depend upon the tissues, whether the tissue is calcified, whether it is hard, tough, whether it is deep, you have a lot of subcutaneous fat. So you, depending upon all that, you choose the different needles. Okay. The swaged needles, that is exactly what I mentioned to you previously. I showed you in the previous picture. Again, also the swaged needles are also called as atraumatic needles. They're very sharp, sterile, and it's just ready to use, and it saves time. So what happens is you see the needle, there is no eye there, but you have straight away the suture coming out. So that is called as the swaged needle. Again, it's a simple thread, and there is no it's actually they're all the sterile stuff. So it's also very important how you open these packages. Okay, so once you open these packages, you are just dropping them onto your sterile trolley. The person, or called as the circulatory nurse, will not be touching them at all. You open the packaging and just drop it straightly into the trolley. So that is a sterile, and that is how the scrub nurse or the surgeon can directly take it up and start using it for the stuff, taking care of the overhead lights. Okay, so how we still with the complete attire, gloves being worn and being used, and this mostly the wet dusting, that is or the what is that, the damp dusting that you're doing. And this is another person that is taking care of the floor, how you're going to be making sure that he's just walking around the table. So this is what I meant by saying that all information about equipment has to be on the wall, so that the person taking care of this also, just by looking at the picture, he will know what he has to touch and what he shouldn't be touching. So because you do not want him to end up touching the wrong handle or the wrong button and finally breaking the table. So that is also very, very important, and clear instructions has to be given by the maintenance department. Here you see the staffs actually taking care of disinfecting a patient bed, okay, after discharge. So that is this actually, the mixture is actually put inside here, and what it does is it actually generates fumes. Okay, so it is being placed inside the room, and the doors are all shut. And once the fumes are generated, it goes into every nook and corner. And what really happens is all the microbes in the air are being destroyed. And why we do this, when we know that any kind of cut open surgery or where is being performed, this has to be done, and very important that for the temperature and the humidity to be maintained, and very important that you put a notification outside the theater saying that do not open the room, fumigation under process. So you do not want anybody opening that room and going inside, because then the whole purpose of the fumigation is lost. So, and this is done so that we know that every day you do this, we know that our theater is safe, it is sterile, and the procedures can be performed in a. Now, the procedure for fumigation: thoroughly clean windows, doors, floors, walls, and all washable equipments with soap and water. Close windows and ventilators tightly, and if any openings found, seal it with cellophane tape. Switch off all the lights, AC and electrical gears. Very important you turn off the air conditioning, because we want all the fumes to be within the walls. Okay, we do not want it to escape. And how you do this is, how to calculate this is, you calculate the room size in cubic feet, which is length into breadth into height, and calculate the required amount of formaldehyde or the gas that is being used. Okay, so this is the way there are ways of calculating this. So again, when you give this in charge to the cleaning department, or the infection control department, they will be taking care of this. When you say that yes, we want the room fumigated, they will look into this, because they know how much to be used and for this particular room size. So this is how it is being calculated, and we ensure that whatever fumigation is done, it is effective. Now, different types of fumigation are gas fumigation, solid fumigation. We learned it in the first, going through this as much. Even this you have learned: disinfection, the treatment of surfaces or equipment with physical or chemical means such that the amount of microorganisms present are reduced. So how we do this? So you're disinfecting the surfaces, the stainless steel cupboards, the walls. And also sterilization, you have learnt in the first year. You just need to go back and brush yourselves with this information. And sterilization refers to any process that eliminates, removes, kills, and deactivates all forms of life and biological agents, which is basically nothing but the absence of microorganisms. So making sure that it is done thoroughly, making sure, and just to ensure there will be no kind of infection that is patients. Sterilization methods are also being discussed: wet method, or by wet heat. So now, what I'm going to be telling here is about the packaging and sterilization. This is regarding the equipments, okay, that's being used in the operating theater room. So sterilization packaging is considered a medical device, and thus it must undergo validation testing before being used in healthcare settings. So this is very, very important. As I mentioned to you, once in the operating theater rooms, the equipments are used, it is being cleaned thoroughly, and then it is being sent to the sterilization department. Okay. Again, what happens there? It is again rinsed properly, washed properly. It is being segregated and it is being checked, making sure nothing is broken, it is still in good working condition. And then the staffs, what they do, they prepare for a thorough cleaning again, and then they prepare for drying, and then it is planned for being packed and put into the sterilizer. So again, it can be done by various methods. So you would have seen how the operation theatre staffs actually open these sterile packages. So it can be done by the flat wrappers, which are nothing but you wrap the equipment, and again you put the indicator tape, and then it is being placed in the sterilizer. You also have the plastic peel pouches, and also the now the different instruments that are being used here. Now, how it is being done, again, it's actually a processing, or it's a procedure that is being done in order to take care of these equipments or instruments. So what we generally do to start with is a thorough cleaning, as I mentioned. Then inspection is very, very important, because you need to check that whatever instruments have been brought down from the operation theatre after use is in good working condition. So nothing is broken, nothing is blunt, or nothing is missing any part. So very important, because this has to be used up for the next patient as well. So you need to ensure that whatever instruments are there, it is still intact and it is still in good working condition. Once the inspection is done, again, it's being sent for packaging. The next step is going to be sterilization. Once the sterilization is done, again, very important is your storage and then delivery of these sterile equipments. And quality assurance is very, very important, because this also has to be checked to ensure that, yes, the department has actually supplied the good and sterile equipments to all the units in the hospital. So these are all the different methods. And this is what I meant by saying the indicator tape. Okay. Now, the first step, as I mentioned, is cleaning, a thorough cleaning. So even manual cleaning is also done for very delicate instruments and something which has got a lumen, okay, like a hollow space. So all that needs thorough cleaning with. So maybe into the machinery you just cannot put it, or the machine does not do it. So such delicate and tiny equipments has to be dealt with manually. Inspection, as I mentioned, you need to check everything is intact. No, you're not missing any screws. Every part is there, and it actually serves. Packaging, again, very, very important. So this is what I meant by saying how it is being packed. So this is actually the sealed wrap, okay, and here you see nothing but the stuff actually sealing the wrap, and this is how it will look like. Okay, the ready product after sterilization, this is what you look like. So this is actually the indicator tape. It actually mentions the date as well. Okay, and so this is how you start off with by saying packaging. It is being wrapped neatly, like how you do the gift wrap, and then you put on the indicator tapes like this, and then it is being put into the sterilization machine. So once it is in the sterilization machine under a certain temperature for a certain period of time, then once it is being removed, you see that this indicator tape actually changes color. So with that, you know that yes, the sterilization process is complete. And then you would put on the little label where it indicates the time and the date and by whom it is being packed. And this is nothing but your what is that, sealed pouches. Okay, so anything that can be reused, this is how you would do it, and you put it into the sterile packaging, and this is called as the sterilization. So this is how you would see a department looks like, which is very, very spick and span, and all the huge equipments. Again, you see that everybody are what is that, dressed appropriately. They are wearing the cap, the gown, using gloves, and again the shoe cover is very, very important. Otherwise, as I mentioned to you, to use the dedicated clogs or shoes for this particular area only. And again, you can see how well the areas are being demarcated with this yellow line. So this is called as the walk area, and how each machinery is being kept properly and sophisticated, in a very sophisticated manner. This is how the equipments are being loaded into the sterilization machine by the staff, and then how it is being packed and how it is being kept in a very, very organized manner. And this is how you see the what is that, the sealed pouches are also being kept stacked properly. And then because everything has got its shelf life, so okay, you don't keep that more than maybe 48 to 72 hours. So once it is there, then it loses its sterilization, it loses its sterility, and then what happens, the same thing has to go back and get itself re-sterilized and brought back. So again, once it is being sent to the department or the operation theater room, also again, it is the responsibility of the staff not to just throw them everywhere, but you need to keep them in dedicated areas with neat labeling. Okay, so you know that which equipment is available where. and make sure that in any which ways avoid. Now, this again you have learned, but I'm just showing you this again, the different methods of sterilization, like you have the physical method and chemical method. So you can just go through this as well and ensure that it is being done in order to minimize the risk of infection. Now, all these are the types of machinery or the autoclaves that are being used. Okay, so this is like a kind of a pressure cooker type. You have the common laboratory autoclave, the vertical autoclave, the large automatic hospital autoclave, and the horizontal autoclave. So these are all just for information sake. I'm just showing you this, the different machinery or the equipment of Unit 6, which is Operation Theatre Technique. Thank you for your time.